So I want to introduce Mr. Henry Cade, who is one of our cardiovascular health action council members, and he's going to speak about his experiences as a Detroit member of the community, and also his experiences with being a council member at Wayne State. So without further ado, Mr. Cade. Mr. Cade, are you on?
You could hear me. Can you hear me now?
Yes, we can. Thank
Oh,
you.
okay, fine. Well, thank you. That's what I said before. Although I'm not a healthcare professional, I am a community member, Black male, senior citizen who has experienced racism across my 76 years. And I've also had opportunities to be serviced by the healthcare system. Now, the planning committee suggested that we talk about three different categories: positionality, perspectives, and potential solutions. So I know we're really short of time, so I'm going to try to truncate this. As far as positionality, as far as my own background, growing up from childhood through adolescence and my early teens, I was blessed to be both with my biological parents and ultimately in a single family home on the west side of Detroit. Furthermore, my dad graduated from Wayne State University School of Pharmacy. He owned and operated an independent drugstore on the north end of Detroit. And my mom drew blood for the Red Cross and the American Diabetes Association in the late 1950s and early 60s. I mention that simply to say that I was exposed to meaningful health care regularly and kind of thought of myself as belonging to a middle income family. Through my 4 years at Detroit Central High School and as an undergraduate education major at Wayne State on a 4 year scholarship, I continue to think of myself as lucky in comparison to many of my peers. So that's somewhat a reflection of my positionality. Perspectives. Upon completion of my baccalaureate degree in special education and starting as a classroom teacher for Detroit Public Schools in the late 1960s, I was appalled at the categorical labels utilized at that time, notably educable mentally retarded, socially maladjusted, and emotionally disturbed. And it just so happened that all three of those groups were in classrooms housed in the basement together of the school building in which I taught. So I mention that because the health labels we use today, in my opinion, sometimes fuel both the structural racism as well as implicit and explicit bias, especially for low income, frequently marginalized communities of color. Hence, we may be a part of the problem and not the solution. So, labels and clarification of those labels is important. Furthermore, I witnessed firsthand through many years of consulting, both across national and international educational organizations, that health related issues and a lack of sensitivity to the clients, almost a disdain between those in authority and the clients they serve. So those are just a tip of the iceberg perspectives from my experience. And so what about solutions? So aside from the enhanced community sensitivity training for health professionals that's been mentioned, that certainly needs to be enhanced. A greater dialogue between the recipients of healthcare and their providers, especially around healthcare vocabulary, and availability of services within the communities in which they reside. Now, my church, Fellowship Chapel, even prior to the pandemic testing and the vaccination service, has hosted health care fairs both inside and outside in our parking lots when the weather permitted for both church and local residents on a consistent basis. So I think we need to collaborate more with healthcare and faith-based entities on behalf of the marginalized communities that are around us. Finally, just as the community advisory board members have been exposed to training modules on bias, research protocols, and strategies to enhance communication. This needs to be expanded to providers alike. And I was pleased to see in the presentation by Dr. Dailey that students as well as practitioners are having the opportunities to have this exposure. I think it needs to be enhanced, and I think that will help us to address some of the structural racism, some of the implicit, and some of the explicit bias. It's an uphill struggle, but we must move forward. Thank you.